The overcrowding at the COVID units in hospitals across the country can very well force a situation where only those who are critically in need of hospitalization will end up being admitted to ward. All indications, based on the number of new infections and daily admittances to the COVID wards, are that families who can manage their loved ones' oxygen supply in the home setting may be expected to do so. But if that scenario ever becomes reality, it will need to be carried out with strict medical guidance.
We don't want to send across the wrong message when it comes to patients who choose to stay at home who have tested positive for COVID. So with that being said, the general idea is that anybody who is symptomatic, they need to be evaluated by healthcare professionals before that decision is made. So, and based on that evaluation, not necessarily does that patient need to be hospitalized, but there are different regimen of treatment that can be administered to these patients. And if, oxygen is needed along with those treatment and the patient can afford to have that at home and receive that at home, then of course.
Dr. Shana Pott is a medical practitioner at the Belize Healthcare Partners with special emphasis on COVID cases. She explains that if the overcrowding necessitates home care, the prescription from doctor to patient will no doubt be thorough.
That prescription that is given reflects on the illness that that patient has at that time, whatever we deem is necessary for that patient to recover. So that prescription comes with the time, how much time a day that patient needs to take that medication, and things like that that they need to follow. And so yes, the prescription is very, very, very informative as we can make it, and for them to follow how they need to take their medication at home.
Can the prescription or the guidance also be given over the phone?
Yes.
Okay.
Yes, there have been patients who have called or even video called for us to see, and things like that.
Quality manager at Fabregas Limited, Leo Smith, agrees that the treatment given to patients at home has to be specific and precise because even the misuse of oxygen can create problems.
Oxygen can be considered a drug. So, if you're administering this wrong, if you're giving too much or too little, it can have physiological effects. So you need to know exactly how much you'll be getting in, right? So that's why the doctor's prescription is recommended.
But while the medical fraternity has not yet collectively moved towards that concept of treating COVID patients in need of oxygen at home, News 5 visited with a colleague of ours whose father was successfully treated the same way when COVID threatened his life last November. Michelle Sutherland explained to us today what her family had to do when the public hospital had no space to accommodate a seriously ill and infected Alfonso Sutherland. She too agrees that with proper medical guidance, it can be done.
At home, we had to set up a privately hospital in his room. We bought the oxygen tank, we bought the thing to test your pressure, test your sugar. We had to buy the one that tests your oxygen and monitor your oxygen level. And we contacted the doctor that had attended to him at the private institution, and he told us basically we don't have to monitor this man by oneself. So he gave us reading, like if he said if it ever reaches this point, you would have to rush him right back at the hospital. So every day, twice, 3 times daily, we would check all of that. We would check his oxygen, his heart, his pressure, everything. And then we would relay back that information to the doctor at the private institution, and yes, that's how we did it.
Okay, so while he was on oxygen, he was also on this medication for hypertension and diabetes as well?
Yes, so what they did at the government hospital, they gave us some medication, but when we checked with the private doctor, he said that your dad have COVID, these won't work. So he gave us his own prescription, and so I went and I bought those. It was expensive, but we bought them.
Sutherland says the life and death situation compelled them to make some common sense decisions.
When we took him home, we were all scared. So everybody from that house had to move to my house, and all of us, we just separate ourselves from him, and we would go like 3 times a day as much as possible. We would go in the yard and we would holler for him. He would come out and he would say that he's okay or he needs something. Yes, but at the first few days he couldn't, so he would just open his window and look out at us. And so yeah, so we never had none of the PPEs. We never had none of that. We would basically go in with our gloves, with our masks, and we would attend to him because we had to extract blood, check his oxygen, all of that. So we never had any of that, and thankfully none of us caught COVID. Nobody in my family caught COVID.
The expense that accommodates oxygen treatment at home can be a bit steep, at least $300. But Fabregas is offering a discounted price on their oxygen package to help ease the burden. Meanwhile, Sutherland says that the overcrowding at the hospital was for her father a cloud with a silver lining.
The best part about it, everything happened for a reason. Them telling him that the wards were packed and sending him home was something good, because nothing like family, he always said. And he lived because we never gave up on him. We were always there. Dad, what do you want to eat? Dad, what can we give you? Dad, because at that point, when you're sick, your body wants certain things. It can't take anything. And so we were always right there supporting him. And that's what he said. That was one of the main reasons why he survived, because his family never gave up on him.
Reporting for News 5, I'm Marion Ali.